Thank you very much. I have been asked to talk about the importance of indoor air quality. At Vito, we do a lot of studies on indoor air quality. The important question to ask is whether air quality is only an outdoor issue, or whether it's not only an outdoor issue. Outdoor air quality has been studied, and we know a lot about the outdoor environment. But of course, if we think about it, the major part of the day, or we spend indoors. We spend indoors in various environments. For instance, in offices, we spend a lot of time. Now we spend a lot of time in home offices, but this is actually also very important because we bring in potential pollutants from offices in our homes. In houses, we tend to cook. In schools, there is more and more electronic devices, so more and more related pollutants as well. Little kids we send to daycare, so there are a lot of kids exposed to plasticizers, for instance. We also have sports clubs, swimming pools. Every indoor environment has its own characteristics and its own pollutants. And in fact, if you continue thinking of that, those are only buildings, but there are also transportation environments in which we're also in an indoor environment. Think about a cruise ship, or about the accommodation of a ship, or the engine room of a ship, but also aircrafts. When you have a difference already between just the passenger part and the cockpit. And also you can go on, like in car indoor environments or public transport. So you can go on and on. It's all indoor environments, and each of these indoor environments is different from the outdoor environment. And how different it is? Well, actually every indoor environment consists of a cocktail of many ingredients. We talk about chemicals like NOx, VOCs, PM, black carbon, all related to combustion, for instance, but also to emissions from products. But we also talk about biological agents, such as fungi, bacteria, and these days, obviously not to be forgotten, viruses. And then there are also the comfort parameters, like the more physical parameters of the environment. All together, they determine the indoor environment. In fact, our indoor environment is always determined in the first place by the outdoor air. This means the outdoor environment has an impact on the indoor exposure of people. If we talk about the built environment, we talk about rural versus urban environments versus industrial environments. If we talk about ship indoor environment, we talk about whether the ship is on just open sea or whether it's in a harbor, for instance. These are all impacts on the indoor environment, and how much it impacts is determined by the building envelope, or the envelope of the environment, like the ship. When we talk about the built environment, we talk about air tightness, about insulation, and about mechanical ventilation. When we talk about a transportation vehicle or a ship, we talk about also the envelope and also its mechanical ventilation system. And then you have issues like, where is the ventilation intake situated? Where is the exhaust situated? Where are potential sources that can be taken into the building or the envelope in order to expose people? And also it's very important to ventilate, to bring the pollutants from indoors outdoors, obviously. A third important determinant of the indoor exposure are indoor sources. Indoor sources are like everything you are currently looking at, like your computer, the table it's standing on, the chair you're sitting on, the clothes you're wearing, the wallpaper, the floor coverage, everything. But it goes also further than that. It's also the people who are around. And clear that these indoor sources, these human indoor sources, became much more relevant also in ship environments. In the beginning of the pandemic, there were a lot of cases of cruise ships with SARS-CoV-2 distribution all over the ship environment. So it's clear that in ships, also in ship environment, humans are an important source of pollutant. And I just want to add, I don't want to go too much into detail about SARS-CoV-2 because you just open the news today and you see many things. This is actually one of the main researchers who was telling the world about the airborne character of SARS-CoV-2 and about us needing to worry about ventilation. And you see a person screaming or yelling, and you see larger droplets potentially contaminated with viruses falling on the ground, but you see the smaller aerosols being distributed in the air, in the indoor room, indoor interior environment, and you see mechanical ventilation or window opening to dilute the concentration and save this second person from being infected. What else I want to tell you? Well, why do we want a healthy indoor air? When we talk about viruses, obviously, it's clear why we want a healthy indoor environment. But there is more. Actually, the indoor environment is determined by thermal comfort. You all know the discomfort feeling about too much drought inside of a house or too much cold temperature. The lighting quality is also a very important determinant of the environment. Acoustical quality, and then air quality. In the Elgas project, we focused on the last parameter, air quality. But that doesn't mean all the other parameters are also relevant and potentially relevant maybe for another next research project. For instance, acoustic quality is a really important determinant of comfort, and it can lead to many complaints and health aspects, effects. So it is also a relevant parameter to consider. Indoor air quality can actually cause three types of effects. You have the acute effects, that's clear, it's like CO contamination. The concentration becomes too high and people die. Then there is chronic effects, which are also very important in ships, for instance, because people are, on the one hand, exposed during their working hours, so it's occupational exposure. On the other hand, if the exposure continues when they are in the private environments, like in accommodation, this becomes like a chronic exposure, which just doesn't stop outside of the working hours. There's also discomfort, obviously, like too much noise can cause discomfort. And there's also decreasing performance. So these are the four important levels of health impacts that you can expect from air quality. How to quantify air quality? Well, at Vito, and obviously there are other labs around, we have a lot of mostly reference materials or equivalents to assess indoor pollutants, chemicals, biologicals, physical parameters. We have many methods to assess them. The consequence of these reference methods is that you always need a step in the lab to analyze your samples, again, which are mostly according to with respect to accreditations and standardized sampling methods. So you need an analytical lab, and preferably you need accredited methods to report reliable concentrations. Besides those reference methods, which are usually kind of expensive, there are low-cost sensors. Some of you probably are using them. The name says it itself, they are low cost. The good thing is that they are low cost and you can monitor many compounds with it. The other important implication is that these sensors mostly need calibration, needs verification in the lab to evaluate their performance. Because all those sensors, they report a different, they may report different concentrations. I just want to show you this plot. Just imagine that the curve is reflecting a concentration in an indoor environment, which is more or less fluctuating. If you then take a sample using a reference method, for instance, this passive sampler for volatile organic compounds, and you start at point X and you stop at point Y, you have a certain average concentration of that exposure time. You could, however, reduce the exposure time, the sampling time of the passive sampler, and then the result will be different. So you will have a higher concentration, but still a correct, relevant concentration. And then you could use an active sampling with a pump on, for instance, the T-next tube. And then you will have a high concentration because you might be able to capture this peak and then the peak concentration. All of them are relevant concentrations and representative for the indoor environment. Yet when you discuss all of them together, you should indeed take into consideration their different sampling times. We have a Flemish indoor environment decree, sorry. This is for the built environments, for public and private buildings. Yet I still want to talk a little bit about it, because it sets guide and intervention values to chemical, physical and biological parameters. It's not quite a ship environment, but when a person is not on duty or working outside of working hours, the accommodation becomes more or less like a public building, like accommodation, or a personal room, like a private room. And then it starts to be relevant to think about the indoor environment decree, because then you talk about lifetime exposure and about longer exposure times, and then the health impacts that are considered there are relevant for these persons. Just briefly to summarize, what are the determinants of indoor air quality? First of all, there's the outdoor environment. There is the envelope and the ventilation system, and there are the indoor sources, pollutants, chemical pollutants, as well as pollutants emitted by people present in the room. A major question is how to create a healthy indoor air. Well, you do it in two ways. In the first place, you always go to a source reduction. Source reduction can be done in many ways. For instance, choosing a different fuel for a ship or any transport means a possibility to improve your indoor environment. Source reduction is also an intelligent choice of materials, indoor materials, but source reduction is also, for instance, in terms of SARS-CoV-2, wearing a mouth mask, because then you reduce the source as well. And on the other hand, there is, in the second place, exposure reduction. Once you have reduced your sources as much as possible, you go to an exposure reduction. You ventilate and you aerate, needed for the building occupancy and activities that take place. If you ventilate, one ventilates smart, so you would avoid transfer of pollutants from the one room to the other room. You would want to avoid the intake or the uptake of pollutants, outdoor pollutants, to the indoor environments as much as you can. Air cleaning can definitely be an option, yet it is important also to go for validated, verified methods and to correctly use and install and maintain the system. That's all I wanted to say as an introduction, just to end some clean air from the sea. Thank you.
Okay, thank you, Marianne. In order to keep the time schedule, I propose that we go to the next presentation.